Now at this time I'd like to invite Karen Kohler to come down and tell her immunotherapy story. And before we do that, by way of introduction, we have a video that we've prepared for you that will give you a little bit of her background.
When you are first diagnosed with cancer, you do just think about yourself. But what you don't realize is the people closest to you. You know, they want to help you so much. We talk about the we because you can't do it by yourself. The we includes family, friends, the doctors, you know, it's everybody. I was diagnosed with CLL and SLL in October of 2011. CLL is chronic lymphocytic leukemia, and it kind of pairs along with small cell lymphocytic lymphoma. We were told, don't worry about it, you'll never be cancer-free. We heard those words.
They said, well, we're not going to do anything, we're just going to let it go. There was nothing to do, you could live 20 years.
At that point, we had a second opinion. We were told, 1% or 2% have these mutations. It was devastating. We weren't told that there was this incredibly ugly side to a very common cancer. And, we found out that it is chemo-resistant and that there is no treatment. And throughout that time, I felt terrific. He wouldn't give me strokes in golf because I had cancer. That never worked. And then in 2014 was when we found out that the cancer had kicked into high gear. We knew right away, chemo's not going to work. Let's do the trial.
So when we met Karen for the first time, we thought that she would be actually a perfect candidate for it because not only she was herself was eager and she was very interested in the idea of immunotherapy, and she was remaining in a very good functional state.
Dr. Park was very good when we first met him, just explaining about the trial and exactly what it is, replacing the T cells, taking your own cells out, re-engineering them, and then putting them back in. He warned us up front, she'd get very sick. That was a good thing.
Your body's supposed to fight the cancer to begin with. So when it doesn't, why not re-engineer the cells to kind of tell them what to do? The trial was going to be difficult, and I knew I needed to be strong for that. My sister, right before I went into the hospital, she had friends and family all make different patches. Like I said, you can't go through something like this alone, but to have the family and Dave and my sister and brothers and my friends, just like, whoa, just amazing. I was admitted to Memorial Sloan Kettering. The cells took about, an hour or so. It was a very small bag, and an hour after I received my cells, I started getting sick. When your body starts reacting to the kill-off, it's called a cytokine storm, and that is when the body is saying, enough. But it's the kill-off of the cancer and the body trying to get rid of it all. The doctors want this storm to continue because the bigger kill-off of the cancer cells you have, the more likelihood that it will be very successful.
The two most common side effects are high fevers, maybe blood pressure issues, and perhaps some breathing issues, disorientation, confusion. That's what Karen got. Patients after receiving the CAR T cells and in the midst of the cytokine release syndrome, it's kind of not easy for the patient's family members to see that. So my job is really kind of educate them and saying, we've seen this before, you're gonna get better, let's just get through it together. Because it's hard to see what comes, even though I know it's a reversible thing.
He said, we brought you to the edge, brought you as far as we could, and then we had to stop it.
It was a very gradual, but every day she'd be a little better.
And I was in the hospital for 25 nights. 8 of those nights were in ICU. We had a doctor's appointment 1 week later, and he walked in and he said, you're cancer-free. And we never, ever thought we'd hear those words. They were getting ready to do the bone marrow transplant on top of everything. And we kind of talked with Dr. Park and said, why can't this CAR T cell trial, why can't this be the cure?
Karen was in the hospital for 3 weeks. 3 weeks after that, she was golfing. So it was brutal while she was in there, but then it was over quick.
Dave was phenomenal, and he knew when to push me and when to not, and I could not have gotten through this without Dave. I came out on March 3rd. My goal was we were having a family reunion at the end of March in Florida.
being able to make that trip, and she got out and golfed, which we were all shocked by. That made it perfect. That means we turned the corner, we were moving on.
For people who are contemplating a clinical trial or not, I think the most important thing for us was just being absolutely honest with the doctors and them being honest with us, and then we could evaluate. Cancer Research Institute supports this immunotherapy completely, and without their research, without their funding, none of this would be happening.
Hello. I want to thank the Cancer Research Institute for inviting me here to speak. I am your miracle. My message today is going to be for patients and their families about empowerment and knowledge and how important that is. When I was first diagnosed, obviously that's so devastating. But then when they told us we weren't going to do anything about this cancer, that we were going to wait and watch, I have cancer and you're not going to go out and attack it. That was very, very difficult to get my head around it. I knew I needed to be positive. I knew I needed to learn. I decided to name my cancers Lucy and Ethel. And it was so empowering because I gave it, well, I first thought if I was nice to them and I, gave them good food to eat, they would be nice to me, but that didn't work out so well. But it was easier for people to talk to me about Lucy and Ethel as opposed to, how you feeling today? That fear of saying the word cancer. And that just was, to me, that humor and that making it was so important, to give it a fun name, that type of thing. The other part, obviously, I went to the internet right away, which just completely, scared every cell in my body. So I decided I needed to get involved with an organization. I did with the Leukemia Lymphoma Society. And what a wealth of information they were. They had all the knowledge of what my cancer was about. They had all the stuff, they support all new trials, all new drugs coming out. They have counseling, they have financial support. They were just amazing. And at that point, one of the women there encouraged me to I was just going to a hematologist. She encouraged me to get a second opinion with a specialist that deals with just CLL. And that was difficult because I really liked this doctor. We were being monitored every, 3 months, blood work. And to get that second opinion was scary, very, very scary. But we did. We came into the city. I had, at that time, a bone marrow biopsy of which those mutations were seen. And it was kind of unheard of to have the mutations before treatment. Normally with my cancer, those mutations usually happen after treatment. The cancer's pretty smart. You hit it with some chemo, it says we didn't like the chemo, now we're going to change. So that's why we found out why there is this wait and watch with this type of leukemia. So we got our second, we found out not only did I have a bomb in my body, but it was nuclear. And we found out it was, as you saw, chemo-resistant, no treatments. We found our way to Hackensack University Medical Center, and Dr. Mato there. He was a specialist in CLL, and he gave us such hope. And he talked about these new immunotherapy drugs, this Rituxan, this Ibrutinib, that were about to be FDA approved. And he talked about this CAR T and explained it to us. And he said, again, we're not going to do anything. We just got to wait for the cancer to explode. But that CAR T is going to be your key. He said, by the time you need it, it'll probably be FDA approved, and you won't have to worry. So it wasn't that much longer, and he left and went to UPenn to work on this trial full time. And at that point, we were meeting a new doctor, Dr. Feldman at Hackensack. My husband never came with me to treatment, to doctor's appointments, because we went with the opinion that we weren't going to hear anything bad. But for some reason this day, he said, I'm going to come with you. I'd like to meet this new doctor. And she didn't know us, we didn't know her, and she walked in, she goes, I'm really sorry to tell you, but your cancer has exploded. We have to start chemo immediately. Now, I had golfed 18 holes of golf the day before. I felt terrific. I was, zero, no effects, no side, I had no signs of cancer at all. So we looked at her and we said, we know I have the 17p deletion. That was one of the mutations I had. And we know it's chemo resistant. So why are you going to beat me up with chemo when it's not going to work? We said, we heard about this trial called CAR-T. Can you get us into that? And she said, wow. She said, I don't know. She said, it's usually for people that have exhausted everything, stem cell transplants, bone marrow transplants, every chemo out there. And she goes, I said, well, Dr. Mato said he'd, help me out here. So she contacted him, and unfortunately they would not take me. I wasn't sick enough. So she contacted Memorial Sloan Kettering and Dr. Park. And as you saw, he was thrilled to have us. And I did go through 14 rounds of Rituxan and Ibrutinib, which were brand new drugs for immunotherapy, and they didn't do anything for me. So with that not working, I was able to get into the CAR T-cell trial. So in 2014 of October, and again, this was more empowerment. Like, had we not said to Dr. Feldman, no chemo, we want the trial, what would have happened? And it was, as a patient, ask questions. I had my notebook, I had questions, I had that CAR-T right on the top. I went through research at, Leukemia Lymphoma Society and some other things. So we knew what that was about. We knew it was really, really cool stuff. So with the trial, Dr. Park, we got enrolled. As you have heard, they took my cells in October. In February, we went into the hospital. And it was intense. It was intense. My husband laughs. He still thinks there might be some cognitive issues left in me, but I do have an excuse when I forget things. But I was, unresponsive for a few days there, and it was much more difficult on my family. And when I came out of it, there were things like I thought I was in Wyoming, and I kept saying that they were selling blood in the bed next to me overnight, and it was just, I was completely hallucinating and all that. But Dr. Park and his staff was unbelievable. They knew exactly how far to go, and since then they learned that to stop that storm, they're afraid if they stopped it too soon, not enough cells would have been destroyed. But they stopped it on me. When I came out of it, I realized they did. I was devastated. I didn't think it was going to work. And when we went back a week after I got out of the hospital, when I left the hospital, I could barely walk. We got back a week later, and that was when we heard the phenomenal news. And since that piece of me with the doctors, they've learned they can control the storm better. The nurses and Dr. Park have said they haven't had anyone as sick as me that intense because they've learned how to control it and to have that work. And after the trial, I was supposed to immediately then go into a bone marrow transplant. For some reason, they thought this was the second component of it. And the donor was set up and ready to go, and I was thinking, are you kidding me? And that's, as we said to Dr. Park, again, that empowerment, that not afraid to ask a question. Had we not said to Dr. Park, hey, why can't this be the cure? Why can't this be? Why beat me up again now for another year, with a transplant? So he again looked at us like, okay, let me talk to the team. Let me talk to the team and see. I said, we're willing to gamble. I said, gamble on us. I said, if it comes back, then we'll do the transplant. But if it doesn't come back, why, let's try it. Let's use me as your guinea pig. And so obviously that was just, unbelievable. This whole, our journeys, I had a dear friend, I have a good friend, she's still around. She fought lymphoma for 13 years and is cancer-free. And she told me when I started this journey to embrace the journey. I thought she was out of her mind. How can you possibly embrace cancer, And she said, God's going to send you angels in many forms. And you're not going to know, why this happened to you or where you came. The doctors, the nurses, the people. And she said, the relationships in your life that you have will grow even more strong. They'll just be amazing. And, things will happen. It'll bring you places. How did I get here? Standing here talking to you. I'm a retired teacher. Never, ever did I put this in my plan of retirement, And so it just, that hope and the new treatments and what the doctors are saying here, there's just so much hope and excitement out there. And I do need to thank Dave. There's no way you can get through this without support. He was my humor he made me laugh when I didn't feel like laughing. He held me when I didn't think I could take another step. So I need to thank my husband Dave, and it's just been an amazing journey, and it's great. Thank you.